So we're here today for two things.
We don't have
I wanted Mr.
We don't have a quorum yet.
We have at least 3 here.
Oh, but yeah, but she hadn't. I'm sorry.
There she is.
Okay.
Okay, before we start,
call roll.
Madam Clerk, can we call the roll, please?
Alderwoman Hubbard. Alderwoman Green.
Present.
Alderwoman Spencer. Alderman Gunther.
Here.
Alderwoman Morton. Alderwoman Navarro.
Here.
Alderwoman Middlebrook.
Present.
Alderwoman Rice.
Here.
Chairman Arnowitz.
Here, finally.
President Reed.
Dock his pay.
6 present.
I'll take it. Good afternoon, everybody. So, before, I wanted, Mr. Wilson to come down and meet the committee, that, you know, people would have questions or anything. So I thought we'd just get this done, so once if we approve it, that we can move forward with it. So, Mr. Wilson, it's my fault. I just thought it was proper, since you're being appointed to a board that represents citywide, that the committee get a chance to meet you and hear from you, and if they have any questions, that we can ask.
Certainly.
Okay?
How would you like to proceed? You want to hear?
Yes, you're actually on the board now.
Correct.
So this is the reappointment coming up, so I guess we'd like to hear a little bit about your background and what you've done already, and you know, why you think we should reappoint you.
Sure. My background is, my training is a clinical psychologist, but I identify as a community psychologist, and I ran a community mental health center that was outside of this area. It was in St. Charles, Lincoln, Warren, Franklin counties. And it grew from having 3 employees back in the late 70s when we got started, and I was the first director. 33 years later, I retired. We had about 425. And we were a community health center also by that point, and an FQHC. But one thing we didn't do very well was work with seniors, and that, you know, and the demographics are such that we knew that was becoming a larger and larger issue in terms of helping people to be able to live full, productive lives independently, as long as they wished, you know, in their own environments, in their own neighborhoods, in their own homes. So I had been involved with the passing of the first statutes for children's services, and passing the first funds in Missouri, in St. Charles and Lincoln and Franklin counties, and it passed fortunately also in St. Louis City, eventually in St. Louis County and Jefferson County, and then it's begun to take off around the state with Boone County and Jackson County and other areas. So I was invited to work with the Seniors Count Group to put together a campaign, and one of the first things that we did was work on a needs assessment, and Mr. Sikora was a key in being able to do that around, you know, in this area. And we were fortunate in terms of being able to get funding from the Missouri Foundation for Health, along with a number of other wonderful foundations that were very supportive, and were able to pass it here in this city, but not in other areas. I've been a resident of the city for the last 17 years, and I thought I could be helpful in terms of helping to structure how to systematically look at what unmet needs were and make sure that we have good outcome measures. And some of those outcome measures ought to be for the board itself, and looking at who we impact and making sure we impact the highest need people, that it's citywide. And so we've been working very hard over this last year in making sure that we got money out the door, but that we did it in a thoughtful way. And the first areas that were funded involved fall prevention. And there were a large number of organizations that had very good ideas on how they could help to make sure that people could safely live in their environments, and we could prevent falls, which shorten that period that people could be independent. And then the second thing was income insecurity, especially around energy issues and weatherization, and even some help in terms of getting people out from under their utility bills. But we knew that is too big a lift, and that we have to work on prevention. We have to work on trying to help people to change environments so that we have weatherized homes and safer homes. And we're working now on the second round of funding. That should be decided by the board coming up in the next month or two, and that there will be, then meetings with potential providers and a request for proposals from them, and we'll be working on that so that more funding goes out in the spring. And by that time, we'll be up to like 4 priorities, but we're looking at probably 6 priorities would be the highest that we could reach with the funds that we have. And and we're trying to make sure that we're working with the community and make sure that those are the right choices, and that we pick things that will make a difference and fill in gaps and help to synergize the other efforts that are out there that have been working for years to try and make a difference. So at any rate, this is my hobby in retirement. This and being on the State Mental Health Commission, and serving on a few boards. And again, I would recuse myself if any of those boards ever, not-for-profits, ever went for funding from this source.
Okay, thank you, Mr. Wilson. What I'm going to do is go around the room for the alderpersons here if they have any questions to ask you. And I guess I'll start with by seniority, Alderwoman Megan Green.
No questions, just thank you for your service.
Thank you.
And your willingness to do this. It's appreciated.
Okay, Alderman Gunther.
Yeah, thank you for the introduction informally while we were waiting, because I think that I was able to get a really good description of what you're doing. We were mentioning, so you said that the 2 priorities you're working on now, the fall prevention and then the financial assistance, bill for assistance, and then you said possibly there could be 4 more, and what would those be?
2 more, and the board will be determining those in the next month or 2. And there are some 2 things that seem to be rising to the surface, and I'm a little bit reluctant to talk too much about them because even though that's an open process.
Yeah.
But I will mention that in our meetings and in inviting in advisors and people who know the community and also know senior services, that 2 that seem to be separating us in terms of things that were doable, that we can make a difference, were social isolation issues. And in the past, those have largely been addressed by having people go to meeting places or whatever. But I think we need to look at some of the neighborhood efforts that go to people and keep people from being isolated. And the relationship that has with mental health issues and depression and all the rest, and also the deterioration in health that can occur when people get isolated. The second area involves minor home repairs and modifications so that homes are safer
Yep.
So along with weatherization, we also want to make sure that there are grab bars and ramps and things like that.
So that was, I'm glad you mentioned that because that was going to be my next question was,
Sure.
Over the last year, I've had a number of seniors that have been looking for assistance with ramps or handrails or even putting like handrails in restrooms, showers, stuff like that.
Exactly.
And
Right.
so I always kind of put them in contact with the St. Louis Area Agency on Aging.
Yeah.
But then apparently they said that money ran out, that they had no money for funds. So is this, I guess you guys, I don't know if I'm jumping the boat here,
Sure.
these are questions for him, but is this something that you also then work with to try to, the board will be working with to try to prioritize how to get more money for those programs?
Exactly.
Okay.
Exactly. And, you know, but also assessments, you know, there are things like loose rugs and, you know, the things that won't cost an awful lot, but, you know, just an educated pair of eyes looking at the environment that an individual's in, the lighting that they have, and other types of issues, along with things like the grab bars.
Okay, all right, thank you, no further questions.
Thank you, Alderman. Alderwoman Navarro?
Thank you, Mr. Wilson, for being here and for your service. And I think this is a good opportunity for us to learn a little bit more about how the city is serving our aging population, especially aging in place. So I'm curious if you can just speak to what are some of the things that you think are working really well, whether it's through the fund or through just things that you're seeing in general that you think are helping people age in the community.
Right. Well, you know, I think, you know, a few things that are, it's important to recognize. We're here as, you know, a Johnny-come-lately to fill in some gaps. That connotes that there's already some infrastructure out there and that there are good people who have been working for a long time to help create a safer environment that also can help people to have you know, a high quality life. And the Area Agency on Aging is, you know, a wonderful resource there, but they've also been capped in terms of their funding for a lot of years, and the needs are growing much faster than you know, so than the resources, and so we have to look very carefully in terms of you know, how can we invest these wisely, because I don't think that we can keep up with the growing needs and the growing demography. So we have to work with neighborhoods and churches and natural groups that are already out there and try and encourage them and see where we can make a little bit of difference and fill in a little bit of gap, because we could never do this alone. We have to look at where the dikes already are and then fill in the spaces, you know, that are beginning to break. And that's occurring all over the place, and I think David Sakura could tell you a lot more about how that's working and where the gaps are. There are some things that are big needs that are out there. We have a wonderful transportation network that's in St. Louis, but in terms of its adaptability for this population, you know, that when we get a frailer, older population, that's going to make less and less difference to them, and they're going to be more and more isolated. The issue is we're not going to be able to solve transportation issues, but we may be able to weigh in on that, or we may be able to help to make sure that people have a voice in trying to be able to speak for their own needs.
So it sounds like we have more challenges than
Yes.
successes at this point.
Yes, we do.
Thank you. I have no further questions.
Thank you, Alderwoman. Alderwoman Middlebrook?
I have no questions.
Okay, and I saved the best for last with Alderwoman Annie Wright.
Thank you. As I was saying, this was actually my first committee meeting since I got elected, so that was fun. Thanks so much for being here. My only question is, I just want to clarify where the money for this comes out. This was the seniors, this was the ballot initiative back in 2016 that created this fund.
Yes.
Okay, all right, that's what I just wanted to, I think there's a lot of terms that we throw around, and it's helpful to sort of clarify the whole picture of where, you know, where this is coming from. And it's really helpful to come back to voters that we, you know, ask for this, to say, here are the things that are working, and here's where the money's really going to good use. So I don't really have any other questions. Thank you for being here.
Yeah. One thing I would encourage would be to invite Jamie Opsel, our executive director, to come in periodically to report on you know, where we are in terms of the fund and where it's going.
Great.
Good suggestion.
Well, Mr. Wilson, you hit the nail on the head when you said that we're way behind times on getting things, which is unfortunate. So how do we do as far as, do we get help from private donations, from non-for-profits, to help, you know, donate money towards services for senior citizens?
Well, that network has been out there for a long period of time, and they've been working very hard. The difficulty is when they turn to private donations, and that can be kind of a flat source after a period of time, you know, where you kind of tap, you go as far
Tapping
as you can
into
go.
it too
right?
much and
Yeah.
try to find newer ones.
Then they look for contracts, you know, and governmental contracts and things like this, and a lot of those have been flat over a period of time. And so many grant sources that are out there, there aren't that many that are just aimed at seniors, and that's a problem. And then those that are, the issue is that if the needs are going to double in the next half generation, and they don't look like those sources are going to be able to keep up. You know, I hope that they can keep up with inflation, you know, let alone being able to you know, keep up with the overall needs. So you know, that's a real challenge at that point. And one thing I think that is happening in the field is that you know, people like Mr. Score and others are coming together in these organizations like Seniors Count, and they're looking at probably not just passing these kind of funds to have one more source, but also to try and take a more, you know, as coordinated an approach as they can to the overall planning on, you know, what are we going to do when our populations are growing like this.
Exactly. Well, first of all, I want to thank you, like everybody else, for taking the time to come down. And I apologize for being late. It sounds like you really enjoy being on the board and helping every way you can. So I guess if no one else has any more questions, I would ask that that we nominate his reappointment on the Senior Citizen Board.
So moved, or? Yeah, so moved in 1 second.
Yeah. We renominate Mr. Wilson for the board. But again, I thank you, because it's citywide. I just think it's, you know, everyone likes to meet everyone who's being appointed. So you know, it's not like we're mad, we just like to introduce ourselves, and that person introduce themselves to us and let us know what they're doing.
Good. I think it's a great partnership.
All right, thank you.
Thank you.
Ms.
Thank you.
Clerk, will you please call the roll?
Alderwoman Hubbard. Alderwoman Green.
Aye.
Alderwoman Spencer. Alderman Gunther.
Aye.
Alderwoman Martin. Alderwoman Navarro.
Aye.
Alderwoman Middlebrook.
Aye.
Alderwoman Rice.
Aye.
Chairman Arnowitz.
Aye.
President Reed. 6 aye votes.
Thank you.
Okay, thank you.
Congratulations.
Thank you very much. Appreciate it.
Yes,
Thank you
thank
for
you.
being
Nice
here.
to meet you.
All right, thank you.
Meeting.
I'm sorry, Pat. did you want to ask a question?
I had a whole bunch of questions, but I'll wait.
I'm sorry, I
Oh,
can't
no, no, no.
see, you're blurred.
As I.
Can you see anything?
A little bit,
I
these
know.
look pink to me right now. So
Appointment.
next up, we have,
Living here, it sounds like.
Board Bill number 100. What this is, it's a chance for a $50,000 grant for the St. Louis St. Louis City Senior Services Fund. And as you know, we have to pass these through the board to be okay, but we have Mr. Sikora from the Human Services Office here.
I'm Dave Sikora. I'm the director of the St. Louis Area District on Aging. And before we start, and I'll be glad to answer all the questions you asked him, I'll be glad to answer a bunch of them. But I would maybe suggest if there was a time that I could come and spend about an hour and a half with you and brief you on all of the funding, where it comes from, what it's going to look like, where our services are, and I can fill in all those gaps that you were all asking about what's going on. So it isn't something you can do in 10, 15 minutes. It's going to take about an hour and a half, but if you would invite me down, I'll have paperwork for you and whatever to do all that, and that might help understand what's going on in the aging network here in the city.
Yep, I appreciate
Sure,
that.
yeah. I'd be here.
Okay, so do you basically want to hold off on?
No, I want to get this done. We need to get this done.
Yeah,
All I'm saying is I can answer all the
Oh, we'll
questions you got.
invite you down for about 4 hours.
Well, no, I'll talk 4 hours, believe me, I can do
Okay.
that. But what I'm saying is, the questions you got, which are all great questions, we can answer, and we can even give you the detail and fill in the gaps that questions you're not asking.
Okay, sounds
Great.
fair. Madam Clerk, can we call the roll for Board Bill 100?
We have a question on it? You want to
Wait
talk
a
about
minute.
it?
Pardon?
You want to
Don't we
talk about
need-
it?
Do we need to call the roll again? Don't we have to talk about
You're not
the?
voting on it right now.
Oh, okay, no, exactly. You have the floor, sir.
Okay, so what this board bills, we applied, one of the things Mr. Wilson talked about was the priorities where they awarded the funds for. We took advantage of doing the economic security thing, and we currently run about 18 benefit sites where somebody can call in, they say, I need to have a circuit breaker done. We send them to a site, we say, here's your appointment on this day, go in and do the circuit breaker. But that time is done for the circuit breaker. And we run it. And so we also have, in the office, they can come in or whatever. But what they've asked us to do with the Senior Service Fund money is take those, we're going to start 5 additional sites. It's called the St. Louis Benefits Plus program. And when somebody comes in and gets assigned and has a circuit breaker done, or one of the other benefits applied, we're going to take the time and do an assessment and follow up with case management to see what other things they might be eligible for. It's a time-intensive thing. I mean, when you have a caseworker, somebody there, it takes, maybe an hour to fill out 1 or 2 of the circuit breaker things to get all the material. And so you don't get the time when you're talking to them, but when you're asking somebody to spend more time to do case management and to follow up and assist, then what we do is we need additional dollars, and that's what we've asked for. And so they're giving us $50,000, and our goal is to touch 100 and essentially 250 new clients, where we're going to do their benefits and then do a case management, up to 3 hours of case management and further benefit work for them, to see if we can bring additional dollars to that person and solve some of their problems. So it's a great opportunity, and as Mr. Wilson said, there's all kinds of gaps, and this would be one of those things that would help us with the gap. We are going to be contracting with 2 of our current contractors who already do case management and benefits assistance. They've agreed to take on the extra work to do this, and fits right into what we're already doing. It just expands the services to the seniors in the city.
What 2 partners are those?
One of them is Mission St. Louis, and the other one is Bilingual International Institute.
Okay, thank you, Mr. Sikora. Again, I'll go around the room to the alderpersons if they have any questions. Alderwoman Green?
So I just want to make sure I understand. So the kind of the difference right now is this will be a more intensive,
Right now, we do
Program.
benefits assistance, so you come in and we sit down, we fill out your circuit breaker, we say, bye, call us the next time you need a problem.
Okay.
You might have all kinds of problems, but you came in for that only. So what we're gonna do now is you're gonna come in and then we're gonna say, can we take a few minutes, ask a whole bunch of additional questions. There's gonna be a little assessment thing that's gonna help us determine if you need more time. And if we have to come and maybe do a full assessment with you to determine your needs for home repair programs or that kind of stuff. But this will give us about 3.5 hours of extra case management on top of the benefits person.
and
the
then referrals to other
organizations, right,
programs.
exactly,
Okay.
exactly. And some people won't need anything, so, but another person, they might only use an hour extra time, where somebody else might need 4 or 5 to get all of their problems solved. So we're working on an average of 250 clients with about 3.5 hours of additional service per client.
Okay, sounds good. Thank you. No other questions?
Thank you, Alderwoman. Alderman Gunther?
Yeah, so I guess I don't really have a whole lot because you're basically just using this, what I had asked earlier about the healthy home repairs or whatever that service.
So I'm gonna answer that question, I can jump in, I didn't want to interrupt what he was talking about. Here's what the problem is, a lot of the different funding that was used in the past from CDA gets their money from the Department of Human, HUD, from Housing and Urban Development. And they, essentially CDA stopped the funding because they thought everything was going to be cut. So Mission St. Louis, who took over, there was an organization called Home Services Inc., Senior Home Security. They went out of business and actually merged, and the business got picked up by Mission St. Louis, and we contract with them for home repair.
Okay.
The trouble is, we can't pay for salaries, so we always paid for the equipment piece, and the CDA money paid for the salaries and the time and for the staffing and admin. Well, that got cut. Then we thought, so then that's where you heard about a lot of things being stopped. Well, then we got told, no, we can come up. They applied for $200,000. It was supposed to be awarded, and 2 days ago, HUD came down and said all CDBG money for home repair is stopped. So all of the funding that would go, we can't get that to do that. So now we have a contract with them for about $60,000, and the most we can do is maybe, fix a doorknob, put in a grab bar, do the stuff, and hope that they can get some volunteer people to do work because they won't have the money to pay for the salary. So our goal has always been home repair. That keeps people in their homes. It stabilizes neighborhoods, and we do a lot of volunteer programs and work with a lot of volunteer groups to come in and do stuff. But unfortunately, HUD just turned down all the money that would have gone for the salaries to pay for their work.
Yeah. All right, no further questions.
Thank you, Alderman.
Bad news.
Alderwoman Navarro?
Thank you. I was just recently at a presentation at STL Village.
Oh, yeah,
with someone from-
Annalisa Stover.
Yes, yeah, great
yes,
presentation.
yes.
I learned a lot, so I was very impressed. 2 quick questions. One, the Benefits Plus program, I don't see that referenced specifically by name in the scope of work that's on page 13, but is that essentially referring to those bullet points down
Yes,
there?
yes.
That's the
This was
Benefits Plus
our
program?
name, what we're calling it.
Okay.
This is the contract that we're getting from the senior fund. Mr. Wilson, when they put the contract, this is what they're doing, and they're asking us to do the enhanced case
Okay.
management, et cetera. So what we're gonna do is we're gonna comply with the things here, but the bottom line is our clients will get up to 3.5 hours or more of extra case management to assist them in getting more benefits and, trying to help them.
So these are new clients, or?
These are all gonna be new clients.
Okay.
So they didn't want us to go and repeat with the people we've helped. Now, in case like next year when the circuit breaker comes up again, well, that client comes in, we'll do it, but we're not gonna go back. Our goal is to try to reach the clients we're gonna be working with and then get them
Okay.
up to speed.
And then, so the $50,000 will essentially cover the staff time, or is there anything else that
It's
that
covering
goes
the
towards?
contracting with each of those agencies
Okay.
for their time. Now, we do have About $2,000 is out for materials and advertising, et cetera. And then there's going to be about $1,000 where we do $10 gift cards as a enhancement for people to come in, et cetera. You find out seniors work best when you can either provide them a service of some kind or give them something, and that's our goal.
Great. Thank you. No further questions.
Thank you, Alderwoman. Alderwoman Middlebrook?
I have no questions.
Yes. Oh, I thought this.
Alderwoman Rice?
Sure, so about how many seniors are you servicing in the benefits program right now?
I can't tell you that off the top of my head.
Okay.
What I'll tell you is, in fiscal year 18, we served 11,048 seniors and persons with disabilities in the thing. About 3,000 of them were home delivered meal clients. Probably 800 or 900 of them were bus pass or transportation, and then all of the rest of our services. And I don't have that. I didn't
Okay.
prepare to answer that
That's
number.
okay.
But when I come the next time and talk to you, I'll tell you exactly
Sure.
what we're serving.
Sure, so you're expecting, if folks who are already using your services come in this next year and go to apply for a circuit breaker, and you're going to be doing more, is 250 extra folk, is that sufficient to cover the number of seniors that you're working? Probably not, nowhere near. Okay, all right.
It's a good start, though.
Okay,
And
yeah,
they're,
we'll
and
start
they're
somewhere.
promising if we do a good job with it, we'll get that money for about 2 more years after, which will
Okay.
just allow us to touch base with more people as we go.
Okay, great. And are you seeing, what are the kind of, and this is sort of a broader question that I'm sure could be answered if we have a hearing and just to talk about this, but are we seeing a trend of folks moving out of the city because they aren't able to access services that they need here in the city at the moment? Or this kind of program helps them stay where they are, helps them
Right,
stay in their homes. But are you seeing any sort of overall trends?
Well, so 2 things. First, you have some people who are moving into the city just because they can get closer to stuff. So my agency does not only seniors, but we do a lot of persons with disabilities 18 to 59 for our nutrition program and transportation. And that number just keeps growing.
Okay.
The senior population in the city stays pretty much the same, except when people either move into a nursing home outside of the city. That's where you'll find most of your residential care facilities that people might want to move to, or in the county, so we'll lose them there. But then we get people, right now our numbers are, I think we're about 9,000 people less than the census was, in 2010, on seniors over the age of 60. But
Okay.
as he said, though, it's just going to keep doubling. It's going to get higher. We're not going to see, the need. People that leave, a lot of times, they can take care of themselves, or they got the ability to move. It's the people who stay here that we've got to be helping.
Sure. Okay, all right, no further questions.
Thank you. Alderwoman Ingracia, did you have any questions?
No. Do you should ask about just federal benefits stuff with respect to the federal landscape, or do that off the record? Maybe. Okay. I don't have any questions, but I heard you bring up Annalise. She's
Stover,
such
yeah.
an asset to the city, so.
Oh, definitely.
Yeah, she's always very helpful. Yeah.
Hopefully you'll see her for years, because I got about 2 more years, and she'll hopefully be here for a long time.
Yeah. Okay, thank you.
Thank you. Make sure there's no other alderman here. All right, thank you, Mr. Sikora. Well, I just wish we could get more than 50,000, but we'll take what we can get.
That was their limit.
Every little bit helps, yes. This board bill here, which is a grant, does need to get approved in committee so we can move it forward. So I guess I'm asking your favorable consideration of passing Board Bill 100 out of committee today.
Second.
Previous roll.
Seeing no objection on previous roll?
Chairman, can we add our names to this?
Sure.
Just the head of it?
Sure.
Any-
All of
yes.
us.
I like my name on too, please.
So,
Oh, move to
Previous
adjourn?
role.
Did we already-
Previous role.
yeah, did previous rows, so,
No.
yeah, motion to adjourn.
Move to adjourn.
Second.
Does that mean this is good to go?
Thanks.
Good to go?
Okay.